great to be here today with you, Mark, to talk about how to do brain spotting online, which I'm very curious about. So just to kick us off with introductions, I'm Ellie Hanson, clinical psychologist and trained in brain spotting, but I haven't used it online with clients. Would be very interested in learning how to do that. I'm imagining that there are going to be some adaptations that are going to be necessary, and don't feel an immediate confidence about doing it online. So kind of excited to come to you with my curiosity and be taught today.
Yeah, it's so timely. Thanks, Ellie. And you're not alone in feeling that, all right, I know what I'm doing in therapy. I know what I'm doing in brain spotting. But if I have to bring these two together online, then suddenly like it feels really confusing. And as you know, Ellie, but for any other viewers, I'm a brain spotting trainer. And over time, for one reason and another, I've been using brain spotting online more and more. And it looks like that's only going to be increasing into the future. So it's a wonderful skill to have. I hear people often talking about different therapies and what we can provide online. And there's so much, understandably, so much anxiety in therapists about doing that. And then there are professional bodies sometimes that kind of also aren't necessarily particularly confident in what it means to do online therapy, that are so full of restrictions that it could get to a point that we can't reach anybody that is remote or isolating or at all with therapy. And then we have to think about, you know, weigh up the actual risk factor of that, not being able to provide therapy at all. So this is only going to increase, and even to the point where the training I'm running soon, which will be in London, we have decided to do the entire brain spotting training online. So it's a 3-day training online. So it's not just teaching brain spotting and how to do it to therapists and psychologists and the likes. It's also in the process, we'll be modeling it. We'll be doing demonstrations, paired practicums, as well as all the teaching online coming up. Yeah, very soon.
Fantastic, fantastic. I mean, this is very exciting for me. I'm probably one of those therapists that has traditionally kind of felt, you know, it's not going to be effective therapy if it's online or via the telephone. And I've certainly had that challenged for me personally, now working with a client or two purely online and on the telephone, and just being really struck by the depth of work, the depth of journeying that can be achieved. So yeah, very excited to hear how that could be further deepened through the use of brain spotting. Yeah, so this is an exciting conversation to be having with you today, Mark. Yeah.
Well, thanks, Ellie. I'll come in there because I think there is so much change, so much rapidly changing, so much rapidly moving in therapy. There has been over the last 10 years, really. And that's only increasing at an exponential rate. And being able to be technologically inclusive in our evolution is central to what we do. And it's not just what we've done before and providing it, we're also learning what we need to do. You know, so it's this integration, adaptation, evolution of what we do. And what's exciting is it can take us to places we cannot even foresee at the moment. You know, that I love. Yes. The idea, the point you made is a really good one. I'm never going to sit here and say it feels the same being online as it does sitting with you in person. You know, we're online now, Ellie, and it has a different feel to it. But it doesn't mean, you know, I think it's really important that we don't suddenly get kind of too polarized about whether therapy is good like this and bad like this. Sometimes, you know, therapy can still be good even though it's different. And for you brain spotters that are watching this, you will have heard me often quote David Grann's words. And David does send his love and has ratified this video. So, you know, you're in good hands. But David often says with brain spotting, when therapists are transitioning from doing maybe talking therapies into brain spotting, and they start to feel that somehow they're compromised, they can't talk as much or interpret, you know, and work in the same way as they used to when they're brain spotting. An important comment David makes is what you get used to is the idea it's not doing less, it's doing differently. when we're brain spotting to talking therapies, and I'd extend that really to working online. Working online, we're not doing less, we're working differently, and that in itself can have a very powerful attunement with our clients, which we know is central to the therapeutic work.
Yeah, no, that really resonates, and it's making me think that online, yeah, like you say, it's not a more limited form of therapy. It's a different form of therapy which has its own depth to it, some of which we don't even know about as yet, but we are exploring them and discovering them as we journey, and they will be different for different people that we're working with.
I think that's really important. As I'm talking about using Brainspotting Online, you know, and we'll kind of go into it more explicitly. This isn't a how-to video. Anyone who's trained in Brainspotting, and this is for those who have, you'll know that we don't do protocols, and we don't do rules, and we don't do kind of black and whites, rights and wrongs. The idea is all of the beauty and the power of the work is in the attunement. That is just the same in Brainspotting Online. It's all about the attunement. If you aren't attuned to your client online, there's still going to be limits to the depth of the work you can do. If you aren't attuned to your client, even if you're working online, there are going to be implications for how safe that client is. You know, how that client can work with very high levels of activation or dissociation, because our attunement is absolutely, absolutely central. So I'm going to kind of talk into that. There's a few categories or sections I want to try and cover. I mean, probably 5 in all, but quite briefly, because time, I know, is of the essence. So I'm going to be talking about transferring your skills, your brain spotting skills, into using them online. I'm going to be talking about equipment in terms of a bit of basic equipment that you will need to do that. I've got my notes here to help me. I'll be talking about some techniques, which is the kind of juicy bit that most of you are waiting for, but the techniques, we will go into that. And I'll be talking about adaptations. You know, when we might work with individuals or we might work with couples and families. I'll touch on that. And then finally, we'll talk a little bit about the positives of online working, where it really liberates and gives us some new opportunities working online. So I'll kind of jump straight into that because we've touched on it already. But we work very, specifically in our clinics, perhaps working with people in therapy and brain spotting. We get into a pattern of working. And it may be that at home, we also use Skype or Zoom or FaceTime, these online kind of conferencing facilities. But it's almost like our neural networks almost kind of be dissociated sometimes. We can operate with people individually, we can operate online, but we don't really necessarily integrate the therapy and the online work. So I can understand why a lot of therapists now have been reaching out to me and to some of my trainer colleagues saying, how do we brain spot online? Well, just to try and help with some of that integration now of the neural networks, I just want to go through a few things that are just going to feel like, yeah, I knew that already, but I just want to make it explicit so it feels more consciously transferable of how you're working in your office to how you're working online with brain spotting. Does that sound okay, Ellie?
That sounds brilliant. I'm all ears.
Okay.
I'm excited. Yeah.
Okay. So the uncertainty principle, you'll remember in brain spotting training, the uncertainty principle is all about, we just cannot know where a client's going. We just cannot know. It's like a river that just keeps flowing the process. And what we have to do is we know if we're attuned and we're close and we're connected to that client, then in uncertainty, that process will go where it needs to go. When we think about the 100 billion neurons in the brain and all of the magic that's happening in the synapses between those, of course we can't ever know that, so again we're dropping into this sense of uncertainty, which I love. Is a certain sense of humility, that there's a power in the process that happens in interrelationships, in therapy, that is just well beyond our knowing brains. Sometimes we talk about our neocortex and how it likes to know things and label things and categorize things, which is very important for us as humans. But also relying on that too much can actually move us further away from the deeper implicit knowledge we have, the subcortical, the deeper brain part that is so key in emotional processing and emotional regulation. And in the trainings, you'll remember you've heard a lot about the relationship between the neocortex and the subcortex, and how in brain spotting we want to get a whole brain approach going. And that, of course, is linked in with the body, because we're very much working with the subcortex and brainstem and relying on the body to really keep the score, as Van der Kolk says, you know, to hold so much of what needs to be processed. So the idea is that really we're staying with the uncertainty principle. We're trusting in the deep, wonderful capacities of the brain, even if they're unconscious, to be able to work with people in the same way in our office as we're doing in our Brainspotting Online. What is a little bit different, I think, with working online is setting the frame. And I know you'll remember, Ellie, you know, setting a frame in Brainspotting training, we often talk about in terms of you sit with a client, maybe they've walked into your office and you say, what would you like to work on today? And they're like, well, you know, and then you start setting the frame, which the way I like to think of it is you're drawing in pieces of where that client is right now in terms of their thoughts, their emotions, their body sensations, that kind of, it's almost like a jigsaw puzzle that hasn't been put together yet, set in a frame. There's all these wonderful parts of the jigsaw puzzle. And then through the processing, what these parts start to do is to be able to relate to each other in a much more meaningful way. Yeah. With setting a frame on with Brainspotting, it's a little bit online, sorry. It's a little bit different in that your client just doesn't walk into your room. So, you know, we're already setting a frame from how we organize the appointment, setting a frame to see if the client has access to some kind of telecommunication platform like this one. We're using Zoom right now today. Checking that the client has the basic information to be able to get online. These kind of things are really important in setting the frame, because your session is only really going to, you know, to be efficient if the client is feeling a certain amount of confidence that they're going to be able to meet their therapist. And I know with technical issues that doesn't always happen. Who knows when Wi-Fi is going to go down and all those things. But we do our best to try and set the best parameters we can in setting the frame. Also, in setting the frame, what's really important is checking with your client that they feel safe where you're meeting with them. Now, safety is relative, isn't it? So if you're working with a client online doing Brainspotting and they're in a war zone, but happen to have some kind of signal and you can meet them online, you know, you want to make sure that they are safe enough, because as we know, the fight, flight, freeze system needs to be fully engaged. So they're not going to be ready to do deeper therapy work. It's all more about self-survival if they're not feeling safe. But just to take that into the home situation, if you're doing some work, check that the person is feeling safe enough at home. You know, if you're working in, I don't know, a relationship where there's domestic violence and you think you're working with a client and the partner may be off screen but sitting just behind them or just next to them, clearly this isn't a place that's feeling safe and therapeutic. So, you know, we have to put a little bit more thought into how we do that, how we set the frame. One or two more things I'll say about that. I wouldn't recommend recording sessions at all, because although that is possible, if the sessions are recorded, you don't know how they're going to be used. And you don't know if a client's going to start putting their session up online or sharing it, those kind of things, which again, you know, can have real risks around them. So just, yeah, in setting the frame, be very careful about that and get a sense of confidentiality and safety with your client before we do this deeper work. Let me check in with you. How's that sounding?
Fantastic. Yeah, just really, like you said, Mark, lots of things that we already know, but we need to make them, we need to consciously apply them to online, and just kind of some pointers, things that we wouldn't ordinarily have to be thinking about, but we do when we're doing it online, in terms of where the client is and the safety of their context, things that we can take for granted if we're seeing somebody in a therapy room that we have control over the safety of, as it were. We have less control over safety in some ways online. And it made me think that, you know, this is on a continuum. At one end, we've got the war zone, we've got the domestic violence, but at the other end, there's also things, you know, if a client might be interrupted by their kids, or the doorbell ringing, even things that might really interrupt their flow. And that could be quite aversive for them. And just, again, we can't prepare for everything, but as much as we can for even protecting against the little things.
It's a really good point. Thank you. And again, if we're just to take it from Brainspotting Online to that happening in your consulting rooms or in your offices, that can happen too, can't it? The client needs to rush off to the toilet, a phone call comes through, you know, a colleague comes busting through your door and says there's a fire alarm. you know, we have to work with whatever comes up. And again, as we teach in the brain spotting trainings, whatever happens in the process is part of the process. Whether that's happening in your clinic, where we have a little bit more safety and control around the parameters, or it's happening in the client's home or other zone. And this is taking us back to what we call the comet and the tail in brain spotting therapy. The client is the comet and we follow them. So if we're following them and following them and following them, and the doorbell rings and the client jumps up to answer it when we're in a brain spotting online session, let that be part of the process. You know, let us be aware. Of course, we're not going to start talking in case someone comes in, the postman comes in and doesn't want to be hearing about trauma and things, but we're going to continue to hold the space for the client. And the client can always let us know, or we can ask them if they need to end the session, if they need to just stop it for now. And then we can do some follow-up work with that, be it online or on telephone. So the comet and the tail is still central in this. This comes to the dual attunement framework. The dual attunement framework we teach is we continue to tune in an interpersonal way to the client. The power is in being connected to your client. We have to work a little bit harder with this online. It's quite easy if you're doing lots of online sessions to be there, to be processing with your client. And then maybe I've got something on my desk and I think, oh, that's interesting. You know, maybe, oh yeah, there's my note there. I must remember to put, you know, cancel the milk. Or you might think, oh, my client's got their eyes closed and processing. A quick check of my text messages. I wonder how, you know, obviously we wouldn't do that in a clinic. And let's keep the same kind of level of integrity and respect, because we do have to work a little harder in the interpersonal work. It might even be sometimes we tighten the frame just a little more when a client's processing, so they know we're still there and we haven't glitched out on some kind of weird Wi-Fi IT thing, you know, just by saying, that's it, right here, right with you, every so often. But you use your judgment with that as you tune into the client. Yeah.
Lovely. No, that makes complete sense. I think, you know, actually there might be that temptation to be less attuned, or I can quickly check this text, rather than actually being online is requiring, if anything, more attunement.
Yes.
Maybe.
More attunement. That's absolutely right. And I think that's a challenge for us when we're used to sitting with people and in the kind of the energetic resonance. We sit with someone in a room and you can feel what they're feeling. Sometimes we call it the limbic countertransference, where I'm feeling what you're feeling and you're feeling what I'm feeling. And there's this lovely kind of connection in the field between us, which is so central to this kind of work in brain spotting. And sometimes we have to work a little harder. It's possible and it does build, but we have to work a little harder to drop into this interpersonal implicit awareness. What does that mean? The kind of connection that's beyond words, the kind of connection that we just feel when we're near someone, whereas we're online, as you said, we have to just maybe work a little harder to drop into that kind of lovely kind of attunement, that lovely resonance. And also to still work with our own bodies as the therapist online, to still notice what you notice in terms of your own body sensations. Because a client may be 1,000 miles away online and we're brain spotting with them, I find you still can feel into what they're feeling if you're kind of really attuned into your body at a somatic level. So still, you know, trust in the process of the kind of energetic transference in the healing. Yeah.
Lovely. No, that's really powerful. And Mark, just, you know, just on this topic of the kind of deeper principles to brain spotting that we need to be keeping in mind when we're working online, are there any other things that you would just flag up as kind of central headline principles to continue to keep very conscious and hold to?
They're the main ones. They are the main ones. But I think in this kind of, you know, in the always come back to the relationship. That's where it really, that's the emphasis, and the co-regulation. And of course, we're doing, use your clinical skills. We're always aware of risk. So we're always aware of what a client's going through. If they're dissociated, you know, if they're hyperactivated, being able to tighten the frame to ground them, everything, ground them. Everything that's taught in the advanced kind of resource model of brain spotting is so important here. It may be that a session ends and you glitch out halfway through because the computer's packed up. I haven't had that yet, but it can happen, or the Wi-Fi turns off. And then, you know, we're following up with that client. You know, we're still managing to connect in with that client at some level if we can, because we don't want to leave our clients vulnerable. But this is just really, again, this is like a normal session. If we're working face to face, we want to still be mindful of their safety. So this is about use your normal clinical skills. Work within your competence. If you've never worked with, I don't know, eating disorders, don't think, well, I'll start working with eating disorders today online. You know, use what you know. If you're not experienced in working with clients with dissociation, then okay, maybe now's not the time. You need to train and work into that. And also one final thing, check with your insurer. Most of them I think are pretty good, but check with your insurance that they cover you for online therapy as well as face-to-face therapy. I think most of them do and are adapting to that more and more now. But you want to feel confident and grounded in the work you're doing because your client will feel that confidence, which is also going to be part of the co-regulation.
Yeah, so several points there that all kind of come back to confidence really, and working within not comfort zone, but areas that we already have a level of comfort and confidence in, and then applying the online rather than doing lots of new things at once.
Yeah, exactly.
Yeah.
Confidence, and competence as well. Yeah, because you know we have competence in different fields, and some of us have different backgrounds and different trainings. Be mindful of that. You know, work within the auspices of your professional training, your professional body, as you're integrating Brainspotting online, as we teach in the trainings. Yeah.
I'm seeing kind of 3 C's: confidence, competence, and comfort. That have them all kind of maybe resonating with each other.
I like that. It's always handy to have these kind of memory devices.
Yes.
So they're the main parts, Ellie. And I was going to kind of just touch on equipment very quickly.
Yes.
So with equipment, things are a bit different, and we're all different, have different levels of skill on using technology. I've been using Brainspotting Online for a few years. So I found that bit by bit, my confidence grew on that. And now, because I run quite a lot of groups and things online, I kind of really enjoy it. It's a lovely way of working. There are some real advantages to it. I don't have to travel to work, and you know, I can be in my zone, in my office working, as long as one can find a nice, safe and protected space to work from, because you're kind of inviting your clients into your personal space. I think just to be mindful of where you are, not maybe sitting propped up in your bed or anything doing it, you know, just be aware of where our professional boundaries are. But the basic technology can be a laptop, a PC, can even be a phone if you need to, as long as you've got a kind of Wi-Fi signal. And there's different platforms you can use. A platform, by that I mean it's different way of having a video conferencing tool in the States, and I think it's catching on over here. They call it telehealth platforms, where you have telecommunications health work. Okay, so this is what we're using now through a platform called Zoom, which I find is quite helpful, and it's pretty useful. So there are different ways of using Zoom. I won't go into it too much, but it's good to try it out, test it maybe with a friend or something before you use it with clients, because you know it's all a learning curve.
Lovely.
One more touch on that as well. It feels like we're connecting in real time, but often there will be a delay between what we're doing and what the client is doing. So there might be a slight mismatch there. So in Brainspotting, because we're so attuned to the nuances of what our client's doing, just be aware of them, but also that there may be slightly different time delays on that. So, you know, we're just holding the space, allowing that with the client, but being quite patient. Yeah.
And maybe there's something about having this conversation with clients around some of the complexities. You know, there might be this delay, there might be a glitch, and just, you know, there's that kind of mental preparation so that if it happens, you know, it's not going to unnecessarily perturb the session, but something that you can both roll with together.
Really good. And then especially when we think about how it might feel so abandoning if suddenly the signal is dropped and the client is feeling that did you hang up on me? Do you not like me? You know, these kind of things. So I think you're right. Part of setting the frame is around the technological aspects.
Yes.
Yeah. So just to be mindful of that. Clients you've worked with before may be able to pick up quicker into working online because you already have a kind of a relationship with each other. But sometimes we just don't have that luxury in having had face-to-face sessions before moving online. But I still think it's important we don't abandon those that are just coming to therapy for the first time, looking for it online. We still find ways of making them feel safe and held.
Yes, I mean, it's an equality issue apart from anything else, isn't it? If, you know,
Mm.
there are some group, like you said earlier, there are some groups that will find it harder to access in-person therapy.
Yes.
And so this is an important
Yeah.
aspect of practice that is mindful of equality and trying to overcome
Yes.
isolation and barriers. Mark, just on the equipment topic, are there any other things that we should be kind of thinking about or aware of, or any affordances of technology that we can make the most of when doing it online?
When doing it online, oh gosh, it feels like it's a big field, Ellie, and one that I know what I know about, you know.
Like I said, I'm just thinking about, you know, you've got the video aspect, but sometimes you've got kind of the ability to write at the same time, or
Okay, yeah.
whether
So on most,
yeah.
good point. Yeah, and on most platforms, you know, if you're using a laptop or something, it'll have a camera, it'll have a mic. You can always, if you want to, add on to those. Like I have my own camera because it's just so much better sound quality, which I'm going to quickly show you here. So I can, you know, so we can add all these things on. So you can take it as far as you need to, but the basics are fine just to get going. You can always add to that when you need to. A lot of these platforms have various things like, you know, you can have chat bars, you can click on them and you can type. I don't know, have you seen my chat bar now, Ellie?
I'm not, but I think that's probably
down the bottom.
I am.
Okay, yeah. And of course, normally I'd coach you into that. So we've got a chat bar, so I can send you references if you want to, or just, you know, write down something. If our sound gets lost, we can still communicate. I won't show you it now, but I can screen share with you. So if I wanted to show you a document, or you wanted to show me a document or something we've done together, maybe even a little video, I can just screen share and show you a little video while you're still seeing me and talking to me. So we've got all these different options going on here. I won't go into too much detail there because I want to get this point across. The basics is enough.
Yeah.
You know?
Okay. There might be some added extras that you can explore before launching into therapy.
I think so. It's quite fun playing with it on a good day, frustrating on a not so good day.
Well, let's jump in now, like you say, to what people probably most want to explore, and I'm interested in, is the kind of techniques and how we do the fantastic brain spotting techniques online.
Good question. So this is the juicy bit, really, isn't it? This is the part that people say, well, how do I do it? And again, you know how to do it, but it's just kind of connecting those parts up, so you know how to brain spot online. This, as you'll all know, is a pointer, and central to your training in brain spotting, we use a pointer. We can use a pointer online, but also we can do great brain spotting without a pointer. So I'm just going to start off without a pointer to start off with. So here's a very quick example of how we can do brain spotting online. So Ellie, I'd just like you to think of something that may be an irritation for you right now. And just as you notice that irritation, I'd just like you to just feel maybe 0 to 10, how strong it feels. You don't have to tell me. And maybe notice where you feel it in your body. Okay. Have you located it? Do you feel it?
Yeah, what I'm noticing is actually where my eyes are moving to, that natural kind of gaze spot.
Well, you're ahead of me. So what I've done is a super quick setup here. Normally in your sessions, spend the normal time you need to set the frame. But what you were doing is just as you're locating something and you're going into the body, your eyes were unconsciously and automatically finding a gaze spot. This, as you remember, you learned in phase 1, you can use so easily and quickly on brain spotting online, even if you're using brain spotting over the telephone, so there's no visual picture, you can talk your clients through finding a position in a gaze spot and processing through that. And then we do the normal mindfulness processing, hold the frame and all those things in the usual way. So the gaze spot is absolutely lovely for brain spotting online. Sound okay?
Yeah, lovely. No, it's making me think that in some ways it may be easier that clients are not, you know, the usual social rules about looking at the person you're talking to. If you're on the phone, they don't apply. That might free people up a little bit to find the gaze spot. There
can be a great freedom in that. And what I often say to people is, don't feel you have to look at, if we're on video conferencing like this, don't feel you have to look at me to talk. I have to look at the camera. just notice where your eyes are. And then I ask them to bookmark that spot. By that, I mean, just notice where that is and say, oh, it's on my vase over there, or it's on the edge of the curtain. Probably, you know, it might be on the cat, but cats move sometimes. But try and find maybe a steady spot where it is, so the client can locate into that and use that. Now, of course, we've got, you know, whenever we use a technique in brain spotting, we can use it with an activation spot where we feel most activated, the strong kind of activation, or we can use a resource spot. So what I might also have asked you to do there, Ellie, is when you were telling me, well, when you're noticing the thing that's maybe frustrating or irritating you, and I would say, well, when you notice that, instead of an activation spot, let's find a resource spot. It's when you notice that, where in your body do you actually feel most calm or grounded right now? So this is me asking the client to notice something that does have activation, but where they're feeling it through a channel of resourcefulness in the body. Okay. Do you notice anything there, just in terms of a sensation that might feel warm, grounded, neutral?
Yeah, I mean, when you asked me the previous question about where in the body was the activation, I think it was probably around the jaw. But, you know, I'm taken to very different part of the body, shoulders actually, and dropping down.
Yeah.
You're asking about where do I feel kind of safest and resourced. Yeah,
that's it.
Very powerful.
Lovely. So what we can do is find a gaze spot on an activation spot or on a resource spot. So again, we're setting the frame. We want the client to be within the window of tolerance, or of course, online, we're working even more into a resource model. So the resource body spot can be a lovely way in processing. Sometimes you'll notice a client will have both an activation spot and a resource spot. Sometimes we set it up. Sometimes it just happens in the process. Someone's processing off an activation spot. Oh no, it's too strong, I don't want to go there. Okay, let's just find in the body where it feels less activated, more calm. Maybe up there where I'm looking at my little plant. Okay, so we can just switch like that. So now they've kind of set and bookmarked an activation spot. They've got a resource spot, and they can choose now which one they're working on. So again, the client is leading, but we're letting them or encouraging them to process within a window of tolerance. Yeah.
Lovely.
So that's a form of double spotting, which we teach in phase 3, but really useful online.
Yes.
Okay. So that's gaze spotting. Another one is inside window. Inside window is, if you'll remember, when I'm using a pointer and I'm asking my client where they feeling most connected to an activation spot, and it might be more on the left, or more on this side, more in the middle, or more on this side. Okay. Now I don't know what you notice when I'm putting my pointer to the far side here. How far is that in terms of your field of vision, Ellie? Is that to the furthest extreme you can go to that side?
Not at all, no.
Okay, so send your eyes out wide for me. Let's see how wide they actually could go. Right, that's it. So because of the little frame I'm in my window, I can't really take it out wide, or I'll be over there somewhere. So what I would say in this case is, if the pointer is not really helping the client, and again, attunement, we can play with this. Ask your client. Ellie could say, yeah, it's right there, and we'll work with it, and I can hold it. But if it's not, and it needs to be wider, we can work with that. So I could just say to you, as you're noticing that activation around some issue, if you take your eyes all the way to the right now. Okay. That's it. And now bring them to the middle section. And now take them all the way to the left. And then I'll check in with you. Where are you feeling most connection with that activation?
Probably to the right. Okay.
And we could spend as long as we need to. I'm just explaining it now, so it's fairly fast. So what we could do there, we're using inside window without the pointer if it feels unhelpful. We're using inside window so you can find it. So you've said if they feel strong all the way to the right, then we'd fine tune that. So I say, okay, Ellie, take your eyes all the way to the right for a moment. Okay. And you can just fine tune it, move them across a little bit, see where you feel into the activation most. Okay. So let's say you've got that spot there, and now we've got the y-axis, remember, which is the higher or lower. So if you just take your eyes on that spot now, just gradually and slowly up, and see where there's more activation, and then you can bring them back down to eye level, and then let them float down lower. And in your own time, you can get the client then to fine tune on the x-axis and on the y-axis where they're really connecting with the activation spot. That sound okay?
Brilliant. Yeah,
Yeah.
that's helpful. It just shows you what can be done without the pointer, actually.
It does, it does. And of course, that was activation. We could do exactly the same with resource spot, inside window resource spot, where I'm using this, or we're using more of a guided kind of induced gaze spot. We call it in phase 3, induced gaze spot, because I'm kind of guiding you through it. Yeah.
Yeah, I mean, would you say there that inside window is generally easier and more useful to do than outside window when you're online?
Well, in my opinion, you know, and that's all I can give really. And from the brain spotting trainers I have spoken to, online, it can be quite difficult to do outside window. Not impossible, but quite difficult. So if I'm asking outside windows when I'm watching to see where you're having an unconscious reaction with something to find a spot. So if I ask you just to follow the pointer now, I'm doing outside window. Obviously, I haven't even been able to start very wide, so already I've restricted the x-axis. But if I come across there, I notice a slight movement in the eyes and dilation there. But what I'm noticing, the thing is, I'm not sure if what I'm noticing is in real time with you, because I don't know if I'm half a second behind you on the video. So I can always ask for feedback, which I'm happy to do. Maybe I just saw your eyes just move a little there. But again, I would want to check in. So what we call in phase 2 inside-outside window is where I'm moving along, but I'm also getting feedback from you. So it's like a combination of inside and outside window, which I find if I'm using the pointer I think is absolutely necessary, really helpful. So if I notice something in you, a movement, then I check in with you, what are you noticing there? And then you get the opportunity to tell me when we've gone all the way across which point, which spot, brain spot you'd like to work with.
Lovely. No, that's making a lot of sense and just feels doable.
Yeah, that's lovely. Doable is what we're after. And, you know, let's drop our perfectionism and our idea of getting it right and things like we've got the client right in front of us, or even if it's on the phone, check in with them what they need, how they're finding it, what would be helpful. And there's your attunement. There's your real guide, you know. So we're not getting hung up on protocols because we just need to be much more adaptive than that. So I've spoken a bit about gaze spot, outside window, inside window, combination of some of those. Also, there are other things we find really helpful in brain spotting for resourcing, such as one-eyed brain spotting. And remember, one-eyed brain spotting, we can identify where we're perhaps feeling, let's say, activation to start with, and we can use an inside window on that. And then we're asking the client to find whether one eye or the other is feeling more activated. So let's say we wanted to work with high activation. Let's pretend you found an activation spot just with your eyes now. And of course, I've done the usual setup where we've set the frame and found the activation. We've found the brain spot. We can find a suds on that. And then I'm asking you just use your hand, Ellie, just to cover one eye for a moment and see if you can just notice the quality of activation that you're noticing through your eye that's open into your body. And then when you're ready, just to use the other hand to cover the other eye, just being aware of any difference. Right, and at this point, I'd say to you something like, what did you notice? So I will, what did you notice?
Yeah, I mean, obviously it's tricky on a practice, but I think, yeah, no, I did notice a difference, put it that way.
That's it.
Yeah.
That's it. And that's the point I'm trying to make. We explore with the client where they feel the difference. And maybe they don't feel the difference. That's okay too. But if they're feeling the difference, they might say, this one feels softer. This one just feels a little bit more edgy. Maybe that's a different, that's a suds 3 and that's a suds 5. Then we can say, okay, let's work with one eye on this. And we can do one-eyed brain spotting. The client can either cover their hand, cover their eye. What I usually ask them to do is get comfortable, because doing that for a long time could actually cause a lot of tension up here. So maybe to be comfortable, I'm on an armrest right now, or I could be on my desk right now. Or, you know, if we're really organized, then the client might even have an eye patch at home. So they can use an eye patch or something like that, or a headband or a scarf or something, just to use one eye or the other. Yeah.
Lovely, great. And would there be any other techniques that you would see as very well suited to doing online?
Okay, well, you know, things like Z-axis are really helpful. Sometimes rolling brain spotting, hard to do Z-axis. If I ask you to look at this pointer now, Ellie, and then I ask you to look right through it into the distance, because we're so kind of two-dimensional.
Yes, that's
It's
interesting.
difficult, right? So what I sometimes do is we've rehearsed this one part, didn't we? Because I said to you, could you have your pointer at the ready? So do you have a pointer at the ready?
I do, yes.
So let's say, you know, and we could use any of these techniques really that you've found a brain spot now. So if you just bring your pointer up and let's say it's where your brain spot is. And again, I could have guided Ellie holding her own pointer there to find an inside window. And then let's say you found that inside window now on an activation spot. We can use the Z-axis as well, which is taught in phase 2, where I'm asking you to look at the pointer. And then at a certain point, if we wanted to resource in a bit more, I could say to you, just like you to take your gaze right through the pointer to the back of the room where you are now. And then I'd probably say something like, what do you notice? How is that?
Yeah, absolutely. And it is very different. It's amazing how you're looking in the same spot, but it is a completely different gaze.
Yeah. And this is another tool we've got if the client is holding the pointer at home whilst we're online brain spotting. And then I can do the kind of convergence work where you're moving between the pointer and the back of the room, which helps with this ocular cardiac reflex and helping to regulate. So you can be looking through at the pointer, through the pointer, and then you can return back to the pointer again. So almost like you've got the client having a visual flow between the pointer and off into the distance on the Z-axis.
Lovely.
Yeah. We could even do proximity work, Ellie, where I'm asking you then at a certain point, if it felt right in the attunement, to bring the pointer nearer on your brain spot, to bring it nearer and see how that feels. And then to stop whenever you feel comfortable. So we've got a chance then to do a bit more Z-axis work, proximity work, or even a bit of a Z-axis sweep. But you don't have to do all these technicalities. We keep it basic, and we can always layer in the resources as necessary so our client can process, you know, to the best of their ability and minimizing any kind of window of tolerance risk issues.
Just a practical question. Not all clients are going to have their own pointer.
Good point.
Would you
Sorry.
Would you want to equip them with one, or would it be a question of using something else at home?
Yeah, well, what I'd say is, what have I got here? What I'd say is maybe the client can get something else. You know, a pencil. Maybe the client can get a pencil. Something like a finger's kind of hard to rest. So if they can get something, it can be useful. And then one can move it as need to. But it could be anything. And it's just a little bit of preparation that the client might have something at hand. If not, we've got gaze spot. Don't get caught up in the detail.
I mean, I feel like I've got a lot to take away with me there in terms of the various techniques in my toolbox that I could draw upon, knowing that they have been used by many other therapists online and seeing how doable that is. Yeah. In a way, for me, that probably feels like enough techniques, but I'm aware that there are going to be other people watching this. What are you feeling, Mark? Are there other things that you just want to kind of highlight? Or
well, with techniques, you'll find that you yourself, when you're brain spotting online, you find more techniques that just feel right with each client. So follow your client as always. These are just ways of building your confidence so you can apply what you already know online. So no, I don't need to cover any more techniques now. There's one other thing that's important though, is that we have the music as well in brain spotting. So music's can be very important. If for any reason the client can't use music, don't use music. That's fine. If the client can't use a pointer, don't use a pointer. You know, if you're doing a gaze spot session on a resource spot, that's brilliant. Do that. But what I'll often do is I'll ask clients to download the music if they can and will, and they can find that on our Brainspotting BSP UK website, free download. Download the music we use, which is this kind of bilateral kind of music. So they've got it, maybe they're on a separate device, maybe on a phone or MP3 player. When the session's ready, they play that, put their headphones on, play it really nice and quietly, and then they can turn up the volume on their speakers of their computer so that they can hear you and also can hear the music on a separate device. It's quite handy separating the two, I find. So the music on one device and the sound on your other device so you can hear your therapist is really helpful. But if a client's struggling with the music or anything, don't get hung up on it. We know, it's all about just getting the process in really in the best way we can.
Yeah. I mean, this question kind of applies whether you're in person or online, but if a client would like to use their own music choice, what's your...
Well, comment in the tail. I often go with the clients. Sometimes clients do either in clinic bring in their own music or at home. So I really want to listen to Vivaldi's Four Seasons. I'm right. Let's try that. And then and they'll let me know if it's helpful or not. And sometimes it is. Yes. So we do what we continue to do. We learn from this is, you know, so much. Brainspotting is relatively new. Brainspotting online, you know, it feels really new. So we're continually learning. And what I've learned, you know, just kind of as we're winding down now, but what I've learned as well, some clients love and prefer it. I've been working in face-to-face with a very complex client who has, you know, various issues, but one of them being, you know, quite an autistic spectrum kind of issue, very strong, severe autistic spectrum issue. Been working on really well in the clinic using Brainspotting. But when I met her for the first time online like this, it's the first time we looked each other in the eyes. Suddenly, bing, bing, we appeared, and I was like, wow. And we looked each other in the eyes, and I felt my heart leap. It was like a connection I'd never had with her before. That just felt just such a gift in itself, you know, such a connection. Yes. And I kind of laughed and said to her, wow, I just feel this was very different. She explained to me, it's because I can look at you now. I can't look at you in real life. I can look at you online. And from there, you know, we really managed to bring that into our work, which is was so valuable. So yeah, I think
and that's really timing with me, Mark. That's been my experience as well. And I think just this point about the online having can have some positives and can offer some freedoms for clients. And, you know, being in person can raise up all kinds of barriers and difficulties that are then not there online. I'm thinking about somebody that I work with where they would experience a much greater freedom to cry, also a safety, knowing that I can't suddenly leap in and touch them, and also the freedom of not being seen. So they can see me, but actually they can move their screen so that I can't see them, which may free them up in terms of crying or whatever they need to do in terms of their processing that they may not want a gaze from the therapist to be on.
This is what, this is such a good point, Sally. And this is what I mean by follow your client, keep learning from them, you know, and don't suddenly think, oh, this works, I'll do it with everyone. We continue to adapt. But also when some clients suddenly can look you in the eyes, that in itself might be quite a shock for them. And they might find a lifelong protector of meeting people like this. Suddenly, when I'm looking at you right in your eyes has changed. The protector's like, hold on, what's going on here? So we just hold those parts, those protecting parts in mind in our work. And what I always do anyway in my sessions, but especially after online Brainspotting sessions, is I keep a window open so that they can contact me. It's often by email. People can contact me in case there's something that they really feel they need to check in, feel uncomfortable about, because of course we want to look after our clients best we can. But it's such a lovely opportunity to use Brainspotting Online, and it's been so powerful. So what I'd say is bit by bit, start to bring it in, to go for it, you know, to use it, and to the best feedback you can get is from your client about how it's going.
Yeah, wonderful. And just, I hear you that we're winding down, but I suppose I'm just interested in, you know, we've talked really about, I guess, working with a single adult client. What about if, you know, our clients are couples or families or children? Would there be, I mean, that those are each kind of huge questions, I appreciate, but any principles or tips you would offer there?
It takes a little bit more of a technical setup. So again, I think play around with your setup first, but it's a bit like I do in sometimes in a session where I might use the music and someone's got the music playing and a splitter. So you can both have headphones, listen to the splitter. Or there might be a speaker over here and a speaker over there, and you've got the couple in the room and the kind of sound is moving between, so that both the two of them are hearing the same sound, moving in the same way. It's nice to have that kind of synchronization when we can. But again, I think you have to know your clients. I think for me, if you've got a client that are all absolutely at war with each other, it can be more difficult to hold the space online, you know, if you're doing that kind of processing work. So I think, again, this is why I said work within one's competency, you know, and if we're experienced in doing this, then that's great. Same with working with children. You want to know that the child is on the other end. If it's a young child, like let's say, you know, 0 to 10-year-old, especially, they're probably going to be there with a parent or carer. And then, you know, one wants to be mindful about what the systemic dynamics are between them and what can be coming up in a process. So we need to know our client group, but there's no reason why we can't work with multiple people online. Sometimes I work online doing brain spotting with groups of you know, dozens of people together. So it's all up for exploration, really.
Yeah.
Yeah.
Yeah, well, fantastic.
Yeah.
Thank you. I mean, I'm feeling confident to take this forward. Are there any final words of wisdom, Mark, that you'd like to share with me and with others?
Yeah, Ellie, just one very final thing is be gentle with yourself. As a therapist, exploring a new realm. Be gentle with yourself. We all have critical parts. We all want to do the best we can for our clients, you know. But sometimes the best we can do is sometimes by experimenting, making mistakes. Sometimes there'll be ruptures, but that's an opportunity for repair. You know, I think we have to really value, you know, the importance of the therapeutic alliance in that way, and to be gentle with our own parts as well as we're kind of exploring this new territory. And not to get hung up on the detail. You don't have to do a model or perfect session. Remember, David Grant discovered brain spotting when he was doing an EMDR session and felt like he needed to stop his hands, and then the young skaters started processing. So, you know, there's also going to be some wonderful discoveries coming, working in this way, if we're aware to them. Yeah. And you know, use your community and your supervisor, because there's nothing like feeding off each other over these new developments.
Yes. So that kind of gentleness, self-compassion, comet in the tail, believing in our clients, believing in ourselves, and believing in the magic between the two.
Well, that's such a beautiful summary. I'm not going to add anything to that.
Well, thank you, Mark. I've learned a lot, and I'm going from here energized and encouraged. So thank you.
My pleasure, Ellie. Thank you very much for your time, and to all the community, keep in touch, and we'll guide each other as we go.